Azactam Vial, also known as aztreonam, is an antibiotic used to treat a wide range of bacterial infections. It works by stopping the growth of bacteria. It is important to take this medication as directed by your doctor and to complete the full course of treatment. The dosage and frequency will depend on the severity of the infection and your individual medical history. It is usually administered by injection into a vein or muscle. Always follow your doctor's instructions and never skip a dose. Talk to your healthcare provider about the best time to take this medication and any concerns you may have. When using Azactam Vial, it is typically administered through injection into a vein or muscle as prescribed by your doctor. The dosage will be determined based on your specific medical condition and how you respond to the treatment. If you are administering this medication to yourself at home, it is important to thoroughly understand the preparation and usage instructions from your healthcare professional. Before using the medication, visually inspect the product for any particles or discoloration. If you notice either of these, do not use the liquid. Also, be sure to learn how to properly store and dispose of medical supplies. For the best results, it is recommended to use this antibiotic at consistent intervals throughout the day. To help you remember, try to use the medication at the same time every day. It's important to continue using this medication until the full prescribed amount is finished, even if your symptoms improve after a few days. Stopping the medication too early could result in the infection returning. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Azactam Vial may include diarrhea, nausea, vomiting, dizziness, headache, blurred vision, or redness/discomfort/pain/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. Tell your doctor right away if you experience any serious side effects, such as fast/irregular heartbeat, confusion, easy bruising/bleeding, ringing in the ears, seizures, chest pain, signs of liver disease, unusual tiredness, or signs of ongoing infection. This medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. Tell your doctor right away if you develop symptoms such as persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool. If you experience these symptoms, do not use anti-diarrhea or opioid products as they may worsen your symptoms. Using this medication for prolonged or repeated periods may result in oral thrush, a new vaginal yeast infection, or a new type of bacterial infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before starting aztreonam, make sure to inform your doctor or pharmacist if you have any allergies to penicillins, cephalosporins, or certain other antibiotics. Also, let them know if you have any medical history of kidney or liver disease. Be aware that this medication may occasionally cause dizziness. It's important to avoid alcohol or marijuana, as they can increase this effect. Refrain from driving or using machinery until you feel alert again. Limit your alcohol intake and speak to your doctor if you are using marijuana. It's important to note that aztreonam may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using this medication before receiving any immunizations or vaccinations. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, aztreonam should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Lastly, if you are breastfeeding, this medication can pass into your breast milk, but it is unlikely to harm your nursing infant. However, it's still important to consult your doctor before continuing to breastfeed while using aztreonam. When taking Azactam Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Azactam Vial include cefoxitin and imipenem. Additionally, this medication may interfere with certain lab tests, such as certain diabetic urine tests, which could result in false test results. It's important to inform lab personnel and all your doctors that you are using this drug. As for the daily dosage and optimal timing of Azactam Vial, it's best to follow your doctor's instructions. They will determine the appropriate dosage and the best time for you to take this medication based on your individual needs. If someone has taken too much Azactam Vial and has severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. When using Azactam Vial, it is important to attend any medical or lab tests that may be required. Make sure to keep all appointments and consult your doctor for more information. Make sure to take each dose of Azactam Vial as directed by your doctor. If you happen to miss a dose, speak with your doctor or pharmacist to figure out the best way to adjust your dosing schedule. Do not take a double dose to make up for a missed one. It is important to stay on track with your medication schedule to ensure its effectiveness. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. Remember to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it has expired or is no longer needed. Your pharmacist or local waste disposal company can provide guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.